Hey there, welcome back to APIC Science into Practice. It's the podcast where infection prevention gets personal and practical and sometimes, just sometimes, a little mega.
That's right, folks. Today, we're digging into something big. Big in scope, big in impact, and yes, big in name. We're talking about the 2025 APIC MegaSurvey.
Woo-hoo!
So, if you've ever asked, does anyone actually know what IPs are going through out here? This episode's for you.
I'm Nikki Shore.
And I'm Jessie Swain. And today, we're not talking about a specific article. We're talking about a movement, a data-driven, workforce-shaping, myth-busting, future-building movement.
Yep. And to help us unpack the who, what, and why, you should absolutely take it. We've got two of our favorite humans in the IPC universe joining us today.
We sure do. First up, we're thrilled to welcome Dr. Sara Reese, newly appointed Director of Research at APIC's Center for Research, Practice, and Innovation. She's led infection prevention teams in hospitals, health systems, and public health, plus mentored more MPH students than there are types of contact precautions.
Yeah, and alongside her, the one and only Dr. Becca Crapanzano-Sigafoos. I did that for your dad.
Perfect.
She is the executive director of that very same APIC Center, longtime IP leader, fierce advocate for staffing standards, and founder of a master's program in infection prevention because, of course, she did. Oh, and she's also a mom of 4 daughters, so she clearly thrives under pressure.
Oh my goodness, yes. Well, welcome, Sara and Becca. We're so happy to have you with us today.
So excited to be here. Thank you.
Yeah, thanks for having us. Can't wait to talk about the MegaSurvey.
Yeah. Well, we're going to break this down into some segments. So for the first segment, let's talk about how the MegaSurvey started, okay? So, Becca, let's rewind. Where did this whole MegaSurvey idea come from, and what were we trying to solve back in 2015?
So I wasn't a member of the research committee back in 2015, so a lot of what I'm going to say to you is speculation, but Sara was much more involved in the world at that point in time and can correct any mistakes I make. But the generation of the MegaSurvey was really coming from a place of how do we comprehensively understand what the practice of infection prevention looks like. There's so many elements in our profession that are unique in comparison with other healthcare professions. And so the idea was, let's actually get some data on this and help to be able to accumulate that data and then analyze it and put it back out into the world so that other practicing IPs know what their colleagues are doing. And over time, so the goal over time then is to be able to watch as our profession grows and changes and evolves.
And so after this first MegaSurvey, can you talk about some of the highlights? Like, what were some of the aha moments? The wow, we really needed to know that stuff.
Yeah, there was some really good stuff that came out of that 2015 survey. As Becca said, I was part of the research committee, and we got a lot of fun publications out of that. We did have a little over 4,000 respondents to the survey, which was awesome. That's about 30% of our membership at the time. So definitely a great response, and we were able to really get a grasp of what was going on. And this was the first time we really started to understand IP workforce and the environment. We learned a lot about the demographics of the workforce, and most importantly, compensation. We were able to pull together a very comprehensive compensation report that was released to all the folks that took the survey. So I think that was super informative for them. The information was revealed about years of experience, professional background, certification, and even geographic location and how that impacts compensation. We also learned about current staffing in acute care hospitals and then the benefits of educational diversity in an infection prevention team.
It's a lot of good information. And then, 2020 came around, which was a pretty slow year for nurses and infection preventionists. Yeah, just kidding. Okay, so this is mid-pandemic. It's mid-chaos. And somehow we still pulled off another MegaSurvey. What did that tell us?
Yeah, you make a good point. The 2020 survey, MegaSurvey, was a little bit poorly timed. We did end up releasing the survey in early 2020. I think it went out in February. However, IPs were already prepping for the pandemic. And so our responses were pretty low. We only had about 13% of membership respond to the 2020 survey, which was unfortunate. And then publications were low coming with that data just because those on the research committee had other competing priorities. So they weren't able to do the analysis that they really wanted to. So we did get some good information, though. Once again, we were able to do the compensation report 5 years later and really compare how things have changed over time, which I think is super fascinating. And then we found out a lot of information about careers and other types of infection prevention programs. So they did some work on non-acute care hospitals, looking at long-term care and rehab and other areas where infection prevention was really starting to make an impact. And then we had a paper that was out about consulting and public health and infection prevention consultants and those that are in public health. So we were able to get some good information, obviously not as much as those that were working on that project wanted to, but definitely informative, as informative as they could have given the poor timing of the survey.
Yeah, and we mentioned that there were a number of papers that came out of the two surveys, over a dozen publications, 8 from 2015 and 3 from 2020. So that's not just survey results gathering dust. Things came out of this. What kind of real world ripples have these insights actually made?
Yeah, I think compensation was kind of one of the biggest ones in my mind. It really helped IPs advocate for more money with all the data, with 2 surveys behind it, especially when you incorporate the 2020 data. And you're talking about years of experience, certifications, and how that impacts how much an IP should be making. And I also think it helps set the stage for the implementation of career ladders for IPs. This is something that's really coming up over the last couple of years with the Career Advancement Guide, and how IPs that are novice are not the same as proficient expert IPs. The expert IPs offer way more to a facility than a novice IP, and therefore their title and compensation should reflect that. And I think that the information we're gathering from the MegaSurvey is really helping inform these changes that we're seeing in our field. We also have really expanded on the understanding of educationally diverse workforce. Historically, IP teams have been made up of nurses, and over the last 10 to 15 years, we've really started to understand that there are non-nurses that can contribute to this field. There's been a whole rush of masters in public health students that have come into the field, and pharmacy and lab, and there's a lot for others to offer. And given the diverse challenges we find in infection prevention, to have that diverse workforce come at a problem in different ways than the nurses had been historically, I think that it's really helped make our field evolve over time.
Yeah. It's fascinating what we've learned from the past 2 surveys. So I'm excited to see the 2025 glow up. This survey, the 2025 survey, has had a serious upgrade. So can you tell us what's new this time around?
Yeah, we're really excited for the changes in 2025. The survey had historically ended with some very lengthy questions around competencies and looking at all of the different competencies of an IP and how competent you felt. And I think it ended up being, those questions alone were over 100 questions. And so we happily removed that section. We found that while there was some interesting information we gathered from it, the amount of time that IPs are putting into that section and the lack of information that we really were doing with it, we felt it just wasn't worth everyone's time. So we also restructured the survey. So we're asking specific questions for specific types of IPs. So for example, if you're a corporate IP director, you're going to get a handful of questions that are really targeted for your field and your work environment. And your questions will be different from the frontline acute care IP or an IP from public health. So I think it'd be really exciting to see just how the different fields of IP are responding to different types of questions that are really targeted for them. We're also including industry IPs, research IPs, and consultants, which we've omitted in the past. And so it's going to be really fun to learn more information about those areas of infection prevention. And then we're really excited about this part. For the frontline IPs, we have a set of questions that are really looking at the current challenges for infection preventionists. So use of technology and how they're incorporating it into their everyday practice, or emergency preparedness, or antimicrobial stewardship. So we're excited to really dive into what are the current challenges that we find for infection preventionists and evaluate how it's impacting their day-to-day work.
Very thoughtful design and structure. I'm excited to participate. So, how does this year's version tie into the bigger APIC research agenda? What kinds of questions are we asking that IPs are actually going to care about?
So the research agenda actually has an entire section focused on IP workforce. And the group that redesigned the survey, which a big major nod to our research advisory panel, which is the group that's been working with Sara to update these questions. That group has tried to draw as many linkages between the research agenda and the MegaSurvey. One of the problems we find in doing that, though, is the MegaSurvey is anonymous, and we want to keep it as anonymous because we feel like we'll get, more transparent answers that way, responses that way, and the really trying to draw correlations as we look at the research agenda. So much of what we want to understand requires outcome metrics, and in an anonymous survey, that's a little bit more difficult to get. So certainly there are some areas on the research agenda that we'll be able to get at with the MegaSurvey in this revised version. Things like appropriateness of compensation in comparison with responsibilities and requirements. And, hopefully I think that'll be a real area of interest for IPs.
Also, is there anything that's new that is building on the 2015 and 2020 survey, or that's brand new and shiny for 2025?
Yeah, so we're taking the opportunity to explore some of those big aha moments from the 2015 and 2020 survey, as we talked about the staffing, the compensation, workforce diversity, and infection prevention in the non-traditional settings. However, we're in 2025, we are really excited to learn about these other roles in infection prevention. I think it's going to complement the career advancement guide that APIC just published, and really giving IPs an idea of understanding what it's like to be an infection preventionist in a different setting, in ambulatory or in long-term care, or to be a consultant. And I think that's going to be super exciting for IPs to learn about, because then it gives them an opportunity to do more with their career. And then, as I mentioned, we are really excited about just addressing current challenges and opportunities for infection preventionists in today's workforce. So really looking at the use of technology. How do infection preventionists incorporate AI in their work, and how do they utilize the new technologies with disinfection, and just really trying to understand, where there's gaps in the industry for technology, where we can help get out of the 20th century and do more with what's available for them. Okay. And then looking at emergency preparedness, coming out of COVID, we obviously worked very closely with our emergency preparedness teams, and really understanding how are we doing that moving forward. And then also antimicrobial stewardship. It's a huge challenge overall, and a lot of times IPs do have that responsibility, or they work closely with those teams, and so we want to make sure that we have a good understanding, and also, once again, how we can help support them.
Yeah, and that helps us roll into the next segment, which is the goals and the myths and the mega truths. So let's talk numbers. This year's participation goal is 5,000. That's a lot of survey completions. It's probably a lot of coffee. What's different in your strategy to get us there?
So our goal is actually 7,000, and I know we're taking it up a notch. And Sara, I think it shared earlier that in 2015 we had a little over 4,000 responses. So we felt like a goal of 5,000 just wasn't enough of a challenge. We've got a little over 15,000 members within APIC, and so if we start to get to the 7,000 mark, we're really getting near half of our representation, which would be amazing. The more responses we have, the more validity there is to the results. And really, particularly in those non-traditional care settings, if it will help us to understand more comprehensively how folks are doing the work in those care settings. And, since the previous surveys, I think that is such a growing area of IP practice, particularly industry and outpatient. And so hopefully having a really large response will allow us to understand those more completely.
Yeah. I think I'm hopeful that we can get there. So let's look at this portion of the show that I'm going to call Mythbusters Survey Edition. Okay, so we've heard them all. It takes forever. I won't have the right info. No one reads these anyways. What's the truth?
The truth is, well, first, I did want to say that we were with us launching the survey at APIC National this year, or APIC Annual Conference this year. We're hoping that we can really chip away at that 7,000 goal right there and then, because we are going to have the QR code take the survey everywhere. So we want to give IPs an ample opportunity to take the survey. You know, they're sitting there waiting for a session to start. The QR code pops up, like, oh, I can start my survey. So I think that's one thing that we're doing differently to really increase excitement about it.
Mm-hmm.
And we also, as I mentioned, we tried to shorten the survey significantly. So we really want to address the it takes forever theory, because I think that was the reason I did not take it in 2020, truth be told. I was like, that last one took me forever, and they didn't do anything with that information since I was on the research committee prior. I was like, eh. So I think that really making sure the questions that they're answering seem meaningful and not just answering questions to answer questions. And so we really put a lot of thought into what we were asking the survey, and why the IPs need to answer these questions, and what we plan to do with it, rather than just collect data. So a lot of times we have, this is a really interesting question, be interesting to know. However, what are we going to do with it? Well, nothing. So we probably shouldn't include it. And so we also try to avoid questions that IPs won't have answers to at their fingertips. So many of the questions we found in the 2020 survey, it was around, a number of patients per year or something, nothing that an IP would be able to just pull out of thin air. So I think really we want to make sure that an IP can just sit down and take the survey and not have to have data prepared there to get those answers. There might be one or two in there that are unavoidable that we really need to know to calculate staffing, but for the most part, we really try to eliminate those questions.
Is it set up to where, I'm sure we can skip questions if we don't have immediate
right and go back
to that.
Yep.
Yeah,
that would be the idea. Yes, that is the plan. And so we also we plan to do some big, great things with this information. This is the first year that we've had the support around this. We have the Center for Research, Practice, and Innovation. We have the Research Advisory Panel and the APIC Research Network, all going to be filled with people that are super excited in this data. And so instead of just having a research committee, we have a whole bunch of people that want to be able to take the data, analyze it, and publish it. So I think it's going to give us the opportunity to get the information out either through publication or through reports and prevention strategists. And so really just trying to get the information out there and do a much better job than we have in the past. And I think that's going to be fun, because the more data we have, and there's 7,000 plus responses, the more information that we can get back to the IPs.
And how long do you expect this survey to actually take the IPs to complete?
I think it's going to vary by which career path you're in. So a frontline IP, they're going to get a handful more questions, because we really want to understand their challenges. Those that are not the frontline IPs will be less so, but it could be between 15 and 20 minutes, but we're still finalizing the survey to have a good grasp on that.
That doesn't seem bad.
No. And are you going to define in the beginning what it means to be a frontline IP for people who may not?
Yeah, there's a section in the beginning that has really clear definitions to push each individual in the right direction.
Okay, all right. And let's be real too. People want to know that their time matters. So what happens to our data after we hit submit? Where does it go? Who uses it?
Well, it goes to Sara, right? And then Sarah's talked about how excited she is to get this data. So actually, we have a group already pulled together that is, some of the same people that designed the survey, but looking at analytics and what it is we want to be able to produce from the survey. So we went and actually took all of the previous papers and reviewed them all in detail and tried to identify those elements that it's going to be important for us to have a historical viewpoint on. And so we wanted to make sure that we have that opportunity for longitudinal design. So we're ready to sort of move forward with analyzing the data and moving things forward into publications. Hopefully by the end of the year. I probably shouldn't make promises like that, though, huh, Sara?
No, I do like that though. That's a lofty goal, but I think we can definitely
Yeah.
get our first couple of publications out by the end of the year.
And it's set in
Yeah.
stone now. You've already said it. So
Yeah.
Right. Oh gosh. Yeah. No. Can we just delete that part?
Roll.
So,
nope.
and looking back at the other mega surveys, you can see some of the dates of publication are 2 and 3 years out, and that's kind of the neat thing about having such a robust set of data. There is if we find ourselves asking another question down the line, and we're able to look back and gather that information from the data we already have, then that's a great opportunity too.
In order to get IPs really engaged in thinking that this survey is worth the 15 to 20 minutes, can you offer an example or two of why this might be important for them? Maybe some real changes that have occurred as a result of the previous surveys, or that could occur as a result of them taking this survey?
Yeah, I think going back to compensation, I think that's one of the biggest ones that we can talk about change, because I really think that with those compensation reports, IPs have been able to understand, the importance of certification and how that's going to impact my compensation. And then the career ladder aspect, I think that it's really demonstrated the differences in the novice IPs versus the experts, and how that impacts compensation. The more time you put into it, the more money you're going to get paid. And I think having IPs to be able to take that compensation report and the publications around compensation and take it to their leadership and have those conversations of like, here, this is a survey of 4,000 IPs. This is what they're making in this area, and then it allows that market analysis, the push in that direction. I also think we've talked about the diversity in the workforce. I think that really having an understanding of the different types of professional backgrounds that are coming into infection prevention, especially over the last 10 years, and how that's impacting the programs, and that it's working and it's effective. And IPs can be IPs if they come from a public health background, or if they come from a pharmacy or lab background. They can do it. There's always going to be a learning curve, but nurses also had a learning curve to get into this field. So I think that the diversity in the workforce definitely impacts how productive the team can be, and the data we get out of those surveys tells us that. And then looking at careers, infection prevention in different settings, long-term care, ambulatory, I think that we get a lot of information out so far from those areas. And I think just the more we do this every 5 years, the more information we can gather.
Sounds like it's definitely worth the 15 minutes.
Absolutely.
So what about at the local level? You talk about how an IP might use the MegaSurvey data to advocate for themselves, but what about their program overall, or plan for what's next?
I think, as I said, compensation's a big one. I think that they can, because we had done an analysis the last 2 years of what is your compensation in certain geographic areas. So we look, and you could even go down to state level, and you could be able to have the conversations at the local level of this is what my IPs are making in this area. And I think that's a huge one. I think advocating for the career ladder, I think that, showing that there are other IPs out there, that's something different within this survey, is we were asking them if they are part of a career ladder, what level they're at, what's the criteria to go from 1, 2 to 3, or however it is defined. And so I think that information is going to be useful for an IP to say, hey, I've been in this field for 5 years, I'm certified, why don't I have a career ladder? And really try to push that at the local level. And then I also think it's going to be fun to be able to demonstrate IPs in other IP careers. So really understanding, historically, we have, if somebody says they're a consultant, they get kicked out of the survey. If they say they're from the industry, they get kicked out of the survey. And so I think it's going to be super interesting to be able to understand what that looks like. How much are they getting paid? What does their job look like? And for IPs that, might want to change from what they're currently doing, they have information at their fingertips on, hey, this looks actually interesting based on what was responded in the survey.
Yeah, I think another important point too is what we learn in the survey informs APIC's planning as well. It informs the research agenda, and our department, the Center for Research, Practice, and Innovation, also oversees our practice guidance materials. And so there are a couple of questions this year that ask IP specifically, what do you need when it comes to practice guidance materials? And that's your opportunity to really help drive the direction of the materials and resources that we'll provide.
So last big question. I hope you're both ready.
Bum, bum, bum.
If you could have one thing that came out of this year's survey, what would that thing be?
Oh boy. I mean, Sarah's talked a lot about the non-traditional roles, and I think that's an area we still don't have a great understanding of what that looks like. And as our profession continues to grow, we're going to see just more and more opportunities, and even looking into schools and prisons and cruise ships and all kinds of other areas where our profession can grow. So I think hearing from those folks is something I'm really excited about. And then international, you said one, but I'm going to give you two. Sorry. But the MegaSurvey is open to everyone, and not just APIC members. It's open to all IPs. And so hearing from others in other countries about their needs and what their practice looks like too, I think is going to, one, allow folks to move further faster and to kind of raise all ships, and two, allow us to really determine where those opportunities are for partnership.
Yeah, so I think I'm excited about looking at the technology aspect. I know in 2020 that was one of their goals, is to understand how IPs were utilizing new technology, and we really take a deep dive into different types of technology. And I think it'll be really interesting to see how IPs are incorporating technology, and if they are indeed making their lives easier, and if they're not, then how can APIC help support them? And we've done a lot of work with the AI Summit, and we now have an AI task force. So I really think that there's opportunity here to understand how we can support IPs more regularly with the use of technology and making their jobs easier. So I think that's what I'm excited as what's going to come out of this, because it's not something we've really dove into before.
Yeah, absolutely. I'm like I said, I'm pumped about it, especially the AI portion, because we can learn a lot from each other on how to use it to make our jobs easier. Because we get it. Everybody's busy. Everybody's burned out. We're buried in audits. So this is different. This is our moment to shape what comes next.
It's quick, it's meaningful, and it's a way to make sure that your voice is heard even when you can't be in the room.
Sara, Becca, thank you so much for joining us today, for all the behind-the-scenes brilliance that makes something like this survey possible. Like I said, I'm pumped. Do it, guys. Do it.
Yeah, just do it.
I'm excited too.
Just do it.
Nikki and I will be waiting, poised to hit that key for that survey.
Better believe it. Absolutely. Yeah.
And to our listeners, when the MegaSurvey email drops, don't overthink it. Just open it, click it, and knock it out in that 15 to 20 minutes.
Yes. Yeah, do it. Until next time, guys, stay safe, stay sharp, go make that mega moment happen. And that's a wrap. Thank you for joining us today. We are Nikki Shore and Jesse Swain, and this is the American Journal of Infection Control podcast, Science into Practice. Thanks for listening and doing your part to prevent infection, because remember, infection prevention is everybody's business.
APIC Science into Practice is created by the Association for Professionals in Infection Control and Epidemiology, with input from the APIC Center of Research, Practice, and Innovation, and Pat Stone and Jean Brandt at APIC and APIC staff, Rebecca Bartles, Ria Gupta, and Bobby Gulshan. We work in partnership with Human Factor and audio techs Blake Althan and Carolyn Schneer. To hear other APIC episodes and to access information about this podcast and the field of infection prevention and control, go to our website, ajicscienceintopractice.org. That's AJIC scienceintopractice.org.